So good afternoon, ladies and gentlemen. Welcome back to the 16th Virtual Postgraduate Forum on Health Policy and Systems. I'm Lika Pravidya Putri. I'm your host for today. So if you attended this morning session of Speed Mentoring, we hope you enjoyed it. And in this warm afternoon, we have our distinguished public health expertise here, and they are going to share their experience and their what they experience in their lives about their career especially. And now we already with us here is Dr. Sofia Hage. Dr. Sofia Hage is a sport medicine specialist based in Jakarta. She's also active as a speaker and moderator at many health events, especially about exercise and healthy lifestyles. And she's also experienced in designing and running education and public campaigns in health. Currently, Dr. Sofia is the medical director and works as a sport medicine specialist at Royal Sport Performance Center, a sports clinic in Jakarta. She is also the official sports doctor for the Indonesian National Wall Climbing Federation. She has experience in multi-event sports such as SEA Games in 2022 and also will be joining ASEAN Paralympic Games in 2022. She is also the co-founder of Lentera Sintas Indonesia, a non-profit organization focuses on sexual violence and gender-based violence in Indonesia. So please, our warm welcome to Dr. Sofia Hage.
Thank you, Dr. Lisa. That's a very wonderful introduction. Good afternoon, everyone. Welcome to the sharing session that we themed Exploring Your Career Options in Public Health. Now, this session is intended to share and discuss how public health professions could be interesting, eclectic, maybe out of the box, and cover a range of options. Public health professionals could come from various backgrounds, and we do hope that we showcase this in our following sessions and professions as well. Now, professionals can be from a medical background, public health, development studies, pharmaceuticals, environmental health, or even banking and finances, as you would see in this session. Now, they could find themselves immersed in public health work in their journey, in their life, and somehow would end up there because of passion. Now, in this session, we will interact with 4 public health professionals who are working in a different role, in a different range and types of organizations. We will also explore how they arrive in their respective roles and their challenges and experience in managing their own roles and responsibilities in public health.
Sof, you're muted.
Hi. Sorry, everyone. Good afternoon. Welcome to the sharing session on exploring your career options in public health. I'm so sorry about the technical difficulties earlier today. Now, this session is intended to be fully interactive, so please do be open to post your questions in the chat box. And this session will share and discuss how public health professions could be interesting, eclectic, and maybe out of the box and cover a range of options. Now, public health professions come from various backgrounds and professions as well. So not necessarily from a medical background. It is usually known that the professionals in public health come from a medical background, but also from development studies, pharmaceuticals, environmental health, even banking and financing, as we would see in this following session. And they could find themselves immersed in public health roles, work, journey in their life. Now, in this session, we will interact with 4 public health professionals, very exceptional, who are working in a range of roles and responsibilities and different types of organizations. Hopefully, their respective roles and their respective experiences and journey will also inspire you to go deeper in your respective roles and explore what you want in your work. Now, we hope you would gain some perspective and thinking that there might be a wider choice of roles as public health professionals. And we do hope that you will post any thoughts or any questions on the chat box so that it would be an interesting session. Now, let's introduce our panelists, our amazing, extraordinary panelists. The first one is Paula Fazil. Now, Paula Fazil is a humanitarian affairs advisor with the International Committee of the Red Cross regional delegation in Malaysia. She is also an Atlantic Senior Fellow for Health Equity in Southeast Asia in 2018 cohort, and such neighbor friend of mine from Malaysia. And her background is in public health. She has worked with various marginalized communities across Malaysia, Lebanon, and on short missions to Uganda, Sudan, Tanzania, and Bangladesh on equity issues, particularly with refugee communities on livelihoods. She has also worked with on community-based projects with refugee communities and with ICRC working at humanitarian areas of focus such as healthcare in detention setting. Paula obtained her Bachelor of Science in Pharmacology and Physiology from the University of Adelaide, Australia, and her Master is from Public Health from University of Malaya, Malaysia. Now, our second panelist would be from, who are we going to go first? Pat. Hi, Pat. So Pat, or Hanwin Pat, is currently working as Executive Director at the Sun Community Health, a national nonprofit healthcare organization in Myanmar with networks of over 1,300 general practitioners and 5,000 community-based health workers at SCH. Now, Dr. Pat is advancing socially beneficial purposes in Myanmar by promoting and providing information, services, and products related to the prevention, promotion, curation, and rehabilitation of the major health services, including but not limited to HIV/AIDS, malaria, tuberculosis, maternal and child health, reproductive health, and non-communicable diseases. Now, he is passionate about strengthening health systems to tackle health and social inequity issues, particularly those affecting the poor and vulnerable people living across Myanmar, with the aim of furthering good health, prosperity, and the relief of poverty, distress, and sickness. He holds a Master of Public Health degree from the Johns Hopkins Bloomberg School of Public Health and a medical degree from University of Medicine, Yangon, Myanmar. Now, our next speaker is Ciara Martias. Ciara Martias is currently, slide please.
Hi.
So, I'm so sorry. My connection is apparently a bit unstable.
I can introduce myself.
Okay. Yes. It's okay. I'm back, I think. I hope so. I have backed up the connection with my phone, but apparently, things like this happen. So sorry. So Ciara Martias is a senior clinical advisor at the Nosal Institute for Global Health, the University of Melbourne, Australia. She's a health system researcher focusing on health inequity in maternal and child health. Before joining the Nosal Institute, Ciara was an assistant professor at the Department of Health Policy and Management at the Faculty of Medicine, Gajah Mada University, Indonesia. And she has contributed to the development of policies relating to reproductive, maternal, neonatal, and child health financing system and child health financing system, and was the lead consultant for the development of the Indonesian National Strategy for Adolescent Wellbeing. She has extensive experiences in working with key Indonesian government policymakers in health programs planning and evaluation, and is now embarking on the topics around health security and One Health. Tiara is also a part of research teams that are conducting several public health projects in Timor-Leste, Pakistan, and Uganda. Tiara was born and raised in Indonesia and completed her training as a medical doctor at the Gadjah Mada University, Indonesia in 2008. She obtained her master's and PhD degrees in public health from the University of Melbourne, Australia. Next, our panelist is Lina Chandra. Lina Chandra founded the Rachel House in 2006 to pioneer the first pediatric palliative care services in Indonesia and helps champion the establishment of a palliative care ecosystem to benefit patients living with life-limiting conditions. Driven by the conviction that no child should ever have to live or die in pain, compassion was the underlying foundation of the organization, and equitable access its reason for being. The outcome has been the flowering of this fountain of compassion, not just in the care that it provides, but extends far and beyond into the communities. Lina has since embarked on a journey in search of an equitable, humane healthcare model to ensure community compassionate and excellent care is available and accessible for all in an economically sustainable way. Lina is an accountant by training and spent the first decade of her career in the investment banking industry. She is an Ashoka and Atlantic Fellow and serves on the boards of Assisi Hospice in Singapore, Common Purpose Charitable Trust in UK, and Bamboo Capital Management. Now, we have very interesting panelists. So without further ado, let's go to Hala. Hala, this first session will talk about how you get here. And what made you decide to take on your current role. So Hala, can you please share with us your journey and your current role?
Thank you, Sophia. Hello, everyone. Assalamualaikum from Malaysia. I believe there are some slides that we could share. I think that for a lot of people, 2 p.m. is 2 p.m. in Malaysia, 1 p.m. in Indonesia can be a bit of a three-titus. And so I decided to share some slides. Okay, so I wanted to tell the fellow students that I started off as a research assistant working with the Bajau community in Sabah. And on my first job, I used to sleep on the job. And I just wanted to say that I no longer do this. So next slide. This is closer to home. In Jawa Barat, I was able to be part of an NGO to NGO collaboration on harm reduction and access to methadone in places of detention. This is where I thought you would appreciate my joke. I hope you. I became a fisherman's friend when we worked with fishermen in the state of Johor on harm reduction for deep sea fishermen. And the several short missions that I had with various communities in Sudan, Tanzania, and Uganda. Let's see this. So in Malaysia, I worked with UNHCR on community-based organizations and programs through livelihood activities for refugee communities. And in Lebanon, it was with refugee communities in the borders, in camp, and also in urban settings. In Malaysia, we don't have refugee camps, so it was mostly urban. This was with the Bajau community on the risk factors towards Shabu. And as of recently, with ICRC, I worked with various levels of society, and some of it are with professors at public health at University of Malaya, where I graduated from, to look into developing curricula for the next future policymakers on thematic issues. Thank you. So to answer your question, Soph, on how I got that, I think the communities that I worked with have brought me here, and I find that after graduating public health, well, right before graduating public health, I knew that I wanted to be more on the field, and I wanted to be working with communities and public health gave me that bridge between science and community. I was a science kid before, and I realized I'm not a lab person at all. And so I decided that with public health, it gives me the skills, the exposure, and also the network to work with communities. As public health students, we know that statistics and epidemiology are the bread and butter of public health, but these statistics actually tell a story, and I was very much driven by the stories that are told by the statistics that we see, and the unseen. And one of the things that I came across was the true nature of society lies in its margins. And time and time again, with every communities that I have worked with, I realized they really tell a story about who we are as a society, and working towards a more equitable society. I know it sounds like a tagline, but I think it has been the guiding light to the work that I've done. So that, I hope I answered your question, what brought me here.
Wonderfully. Thank you, Paula. It is that you mentioned about equity. It is worth mentioning that we are all Equity Initiative Fellows. And for those of you who are interested to know about Equity Initiative Fellows, you can reach out to any of us in the forum. Okay, so before going to the next question, I would like to go to Tab. Tab, can you please explain to us, how did you get here? And what kind of journey did you actually go through?
Sure. Yeah. Thanks, Sof. And I did not have like a fan picture like Koala, but I tried my best. So maybe next slide, please. So I trying to explain like by era, like before I joined public health, and then why I stay remain in the public health, and also the work that I'm currently doing. So I went to med school in 1996, and just 1 month after the med school, my school was closed for about 2 years. I like to give a little bit of context, because we had a big student protests, and that time military regime, they closed all med school for 2 years. And then my medical student life was a lot longer. So then I graduated in 2004, and during our time that we had compulsory like public health service in civil service for 3 years. And it was a big decision to make because if we did not join that a public service, civil service, and then I won't get a medical license. So, but finally I decided not to join, and then instead I joined for a public health organization working in Myanmar. So it was one of the largest international organizations in Myanmar. We mainly work with the private care providers, and then also integration of that private health services in the public health system. So my role was like a monitoring and quality assurance of those service providers. And I worked several positions in that organization that actually left in 2015, and then I went to grad school. And in 2017, I rejoined it back. At that time, we started working on the localization agenda. So because those are the trend of international organization to be localized and work as like a more sustainable like a public health programs in Myanmar. So then studying in this year, so that I became a first executive director of that science community at the local NGO. So why I remain in the public health? Next slide, please. So there was a turning point in 2008 because I always wanted to be a pediatrician, a physician. So it was kind of like a dilemma whether I should still remain in clinical work or public health work. So then in 2008, we had a large cyclone hit within one night. That you can see over 130,000 people, they lost their lives. I was there and I led a Medicaid team there, and I worked with like local doctors, and I went very deep in those cyclone affected areas. I've seen so many tragic stories. So, and then I'm seeing like there are so many gaps in the public health, and also in terms of policy, in terms of disaster preparation, and response, in terms of like building a resilient health systems. So then, and then I thought maybe it could be more I may be more passionate about working in this area after seeing all these things. So that since then, I decided to stay my life in public health. So I continue keep working on. And also because I live in Myanmar, we have maybe some extreme case in Southeast Asia about all the political crisis happening, off and on. So maybe next slide, please. So currently, I'm working in an organization as executive director. So this is why the coverage of my organizations. So we have 5 offices across the countries with like 400 staff working. And then that on the right side, that you can see like conflict maps in Myanmar. In last 2 years, there are over 13,000 conflict events in Myanmar, mostly after like a political crisis in February last year. So health service provision is so much distorted, and public sector is no longer sufficient to provide healthcare. So then we have a tremendous workforce of like private providers continue filling the gap in public health service provision. So then this is my current priority and work to pull the strain as much as we can to provide health services to all the most needed people in the country, because those are life-saving health services. So that's why I remain here. I stay working on. Over to you, Sophie.
Thank you, Pat. Very interesting. We'll go deeper into the field or the projects that you do and the challenges you face. But before that, we still have 2 panelists, and the next one is Tiara. Would you please share to us how you got into where you are right now and the journey that you have been going through?
Thank you, Sophia. Hi, everyone. Glad that a lot of people are interested in joining the session. So we're very happy about that as well. So I'm Tiara. I'm here as a representative of the boring academic. So we deliberately set up the panel, exciting, 3 people exciting. 1 is like the usual academic. So what do I do? I used to teach at Gadjah Mada University as a lecturer. And then recently I got a opportunity to work at the Melbourne University, particularly at Nossal Institute for Global Health, where I did my PhD just 2 years ago. So a lot of my career move has been in academia. Next slide. I did start off as a medical doctor, but then I like interacting with patients. I like working in a clinic, but I'm also very anxious of killing anyone, to be honest. So, and then I got a great mentor when I was just in my 2nd year of medical school, who kind of forced and introduced me to the public health. He said, his name is Dr. Mubashir. Some of you might know him. He said, if we can help patient by working in a clinic or hospital, but we can change the system and change the policy if we work in public health. So that kind of stuck to me. And also, I don't want to kill my patients, thinking, oh, maybe there's other ways to help people, to help the system, to kind of improve a bit, and be part of that nuts and bolts. I'm just going to be a small player, I know, but that's fine. As long as I'm a small player in changing the system towards more equitable health and healthcare access. So I decided almost straight away, after just working for a bit in a clinical setting, to do my MPH at Melbourne University. And then I decided to, I don't know a lot of stuff about public health. I know some, maybe as a researcher or a research assistant, similar with Kaula, I might be able to broaden my perspective a bit, explore Indonesia, explore public health. So that's what I did for a few years before I decided, okay, now I need to kind of upgrade myself and started my PhD in 2016, graduated in 2020, also in public health. And then I love teaching and I love sharing knowledge and also learning from my students and peers and colleagues. So that's one of my passions as well, is to teach and to share and to have discussions, fruitful discussions with students and colleagues. So that's part of why I did what I do. I do what I do, which is teaching and in any form. So tutoring, lecturing, sharing, or whatever. And then, like I said, in just a few months ago, I got a position as a senior technical advisor. So mainly on public health financing, on health security and One Health, which is also new to me. It's a steep learning curve, but I really enjoyed it. And along the lines of my work, I've been blessed with collaborating with a lot of NGOs, governments, and everything in between in the public health aspect. Next slide. Just to make myself a bit more exciting as a researcher, I do extreme stuff as well. So these are some photos of, I want to compete with Kaula, just showing that it's not just all boring stuff, dealing with numbers and papers and publications, but you get to explore, different settings, work with different people, learning from different projects as well. So this is just one when I had to visit Papua for an investment case on maternal and child health. I definitely did go through a 12-hour boat ride in this Bovendigul River for, almost half a day. And they say it's a crocodile infested water. I didn't see one, but I'm sure if I plunge into the water, I might die. And then as said, we can talk as well about PhD. What I did, I really enjoyed it, but it's not just because PhD is boring, really. It's a 4 years taken away from your life, and it's a very lonely journey. But next slide, I did a lot more during my PhD. So I tutored, I do research stuff, of course, but also work as a kitchen hand making sandwiches. I sell newspapers and whatnot, and I do a lot of traveling. So if we want to talk about why PhD could be interesting, it's not the research stuff, it's the other stuff. So that's how I get here pretty much. Sophia, thank you for the question.
Thank you, Tiara. Very interesting. Other stuff than the PhD. Okay, next up is Lena. Lena, can you please?
You're muted.
So you're muted again.
Hello. I think it's because of my connection. Every time it drops down, it automatically mutes myself. Anyways, okay, so next up is Lena. Lena, can you please tell us your journey and what made you decide to go into public health?
After the 3 Indiana Jones, I feel like I must be the boring banker. I am an accidental tourist in this world of social and health sector. I thought I came to build a building, to build a structure to alleviate suffering of the children. I stayed because I discovered that the structure upon which I have built my world, or my understanding of the world, needed to be transformed in order that I can serve better. So just for people who don't know what sort of world I've stumbled into from the investment bank, I've stumbled into the world of palliative care, where we give services, care for children living with cancer, with HIV, with terminal illnesses, but typically at the final stages of their lives. And the main purpose of the organization is to make sure that children don't have to live or die in pain. So why did I stay? And I don't think I actually knew why I even stumbled upon this role in the beginning, but why I stayed. One, I stayed because I realized that being in a nonprofit world gives us, or gives me, the freedom to formulate and implement solutions that hopefully will transform the world and make it a better place and more equitable, not just services that benefit a few, but for all. Being outside the established infrastructure, I know now, is an incredible freedom that provides us the freedom to innovate, to pilot, to implement solutions, and dare I say, fail and fail quickly and spectacularly, and then hopefully, importantly, to learn to pivot and then try again. This is not something that I have found available to people who are within a much larger organizations or even within a government, to actually be able to pilot solutions, and especially in healthcare. But within the nonprofit world, we have, I guess, what in today's terminology, we are the sandbox where solutions can be piloted and solutions can be germinated. And this is really important, I think, especially as we make a choice as to how do we create change quickly today in a world where there's so many problems. If you want to be able to innovate, then choose a place where your hands are not bound. Second reason why I stayed, different from the investment bank world, the nonprofit world and the social sector and the health sector is, I feel, a world where it's purpose-led. And this is perhaps a double-edged sword, because while in the nonprofit world or in a healthcare sector, we march to a much grandeur and much grander purpose. But also, I think few of us actually realize that in order for the organizational purpose to actually be accomplished, we have to learn to let go of our personal ego and allow that personal ego to die, because otherwise it's a competition between the organizational purpose and our own personal ego. And if that sounds scary, I think perhaps we can actually view it as more liberating. And why do I say that? Because if we live a purpose-led life, I mean, we've heard from Kaula and That, and then Tiar, where she said she doesn't want to kill patients. If we listen to some of these purpose, underlying that purpose is that courage to name a certain purpose in our life, whether it be, I think today it's the Tat's purpose is probably the clearest. Why did he stay? Why is he staying where he is when very easily Tat could have left Myanmar, especially in the current situation? But a purpose-led life allows us to live an incredibly, I guess, liberating life, because for the first time we could put aside that personal ego and drop into this sense of wonder and curiosity. And there we learn to basically, because sense of wonder and curiosity is probably the most important criteria for us to learn, and for us to have the humility to collaborate and work with others towards a common good. So here in the life of Rachel House in the last 15 years, I've learned to kill my personal ego in order that a larger purpose of the organization can actually thrive. And that's, I feel it's a good reason to stay. The third reason why I stay is that I found probably the most challenging of my life. Working in the investment bank is nothing like working in a social sector. It's much easier. In the social sector, we are being called, and when I say social, I actually mean the larger sort of factor of health and public health. Here we're called to actually solve a much larger problem that in the investment bank, I was definitely not called to solve. And why do I say that? I feel like in this world of social ills, we're looking at an incredibly complex, multi-layered, diverse problem that is, that is in life, that whole capital L-I-F-E, life. And so I've learned here to basically look at the problem that is in front of me, but also having to always keep a much broader vision of the problems, the overarching problem in the horizon. What is impacting the community? What is impacting the society at large? What is impacting the country? And why is this important? I can maybe give you an example. Rachel House works in the area of HIV, and that's part of the problems that we look at. What we look at is children born with HIV and often with multiple opportunistic infections, and sometimes at the end of their lives. But we all know children with HIV should not happen anymore. There are ways to prevent that. Our organization, Rachel House, looks at the largest number of children from all hospitals within Jakarta, and that I believe no other organization look at. And we have a partner organization who we've been working with for a long time, a different organization, but they look at the psychosocial factors impacting these children. So a couple of months ago, I reached out to them and I say, if we're going to do this well and prevent any children in Indonesia from being born with HIV, because we know Cuba has done it, Singapore has done it, many countries has done it successfully, then let's combine our forces and collect data on all of the suffering that these children go through when they are born with HIV. The answer that came from this organization was, we don't do that work. That brief belongs to other organizations. We just look at the psychosocial factor of the children born with HIV. What is the impact of that? The impact of that is that we no longer can present the total consequence and the burden on society when a child is born to the government. We cannot push a bigger agenda for prevention of mother-to-child transmission. And the impact of that on the next child born with HIV, the next family having children born with HIV, the society at large, the health system that continues to have to deal with all these children coming into the hospital, flooding the hospital with opportunistic infections, using up ICU, using up ARV, and using up all of the society's resources before we even consider the suffering of the child and the family. Just because we work in silos, just because we keep looking at the problem today in front of me rather than horizon, rather than what is it that we're called to do here in our lives. So I think I stay here in this incredible sector because I believe it takes commitment to a purpose. It takes focus and attention, and most of all, faith in common humanity in order for us to serve and create a better world. And there's no other industry that provides this. So anyway, thank you, Soph.
Thank you so much, Lena. Now, I know each of you have already touched a little bit on challenges that you face. Now, I would go deeper into that by asking, can you give us a story, or can you give us an example of that in your daily work throughout your journey? And I'll go first to Tat. That knowing the complex situation where Myanmar right now is, how does that correlate to your role? You were mentioning there was a lot of conflicts that you have to deal with. What were the challenges, and have you ever thought of giving up, and what made you persevere? Other panelists, think of it around the same question of that.
Yeah, sure. So, sorry, the electricity is out. We have 8 hours electricity cut every day. I even live in Yangon, the biggest city in Myanmar. That sounds like, rationing happening. Little bit of context though. So,
if I may, Tat, you have a slide on challenges, right? So, if the committee can help me to share the slide on Tat's challenges, so we can probably see that as well. Thank you. Please go on, Tat.
Yeah, that's what I'm actually working on day to day. So because, as I said, this political crisis is a real thing. We have to deal with that anyway. So our current main focus is that, to keep this bloodline of like, essential health service keep going. So then, there are a lot of travel restrictions in those, conflict areas, like, at the fighting area. So it's really challenging for us to send those, medicines to those areas. We have to find so many ways to send, those drug supplies. And also last year and this year, COVID is still going on. We have lost several doctors and also our community volunteer last year because of COVID. So there are safety and then safety of our staff, in the during this health service provision is our essential work. So that we keep going on, like, because there are a lot of vaccine issue here, because of logistic issue, many things. So that even like, when you have COVID, there is, we don't know where to go if you even have COVID. So, these kind of things that we have to figure out. So we have a lot of like, government related, like, registration and, MOU issues, because there will be very long process, even in normal situation is now even getting harder. And also because we require a lot of funding and also a lot of like, cash flow management. Currently, there are restrictions on the fund management, so that even we receive the fundings, the donor cannot transfer to like, directly to the organizations. So because that, it's only allowed to use Myanmar jets, the local currency, not USD. So that, there will be automatic, like, a transfer from USD to Myanmar jets if they are like, several, a certain level, and then we have to go up to the Central Bank of Myanmar level for this cash flow and, fund management. So it kind of a lot of headaches, without that money, you cannot do anything. And also we have commodity shortage for some areas. And also they are, for example, like malaria. So we were one of the country in the stage of like, elimination of, Falciparum, Plasmodium falciparum, lethal malaria. Now we are even seeing more and more cases of that malaria. So that malaria is coming back in current situation. So then we have to work like, differently, and then also think differently how to tackle this issue in the current crisis. And also at the same time, we are having like, a commodity shortage to tackle those. And also another global phenomenon, fuel price increasing. We have a lot of like, a problem in like, remote areas. If you don't have any fuel and then you are traveling like, maybe 40 miles, and then you have to walk for like 2 days, without even with the motorbike. So these are the like, current challenges. I don't want to disappoint people, but things we are working on day to day to keep those health service provision going. What is of?
You're muted again. Okay.
So Ted, what made you stay? Well, at what point when you were faced with challenges did you ever decide that, okay, maybe this is not for me? Or have you ever thought this is too much? And what made you stay? What was the resilience factor?
Yeah, I don't know, but maybe I don't have a choice because I'm seeing a lot of like, intellectuals, living in the countries, and if there is no one, without, boots on the ground, who else will do, this incredibly complex work? So maybe I'm stuck, maybe I don't have any, enough motivation to go out. Or maybe I don't know what to do either. So, at this point is, I don't think much actually. I don't even think I'm sacrificing. I'm doing what I have to do. So that's what, we need to do, I think.
Because if it's not you, who else, right?
Yeah.
Okay, Hala, can you please tell us a story about your challenges? What was it that you faced? What was the difficulty? And have you ever thought of giving up? And what made you stay?
Thanks, though. And thank you, Ted, for sharing. I think I will provide the students a different sort of kind of answer. Two things. I think number one, the challenge I feel that if you're going into public health that you will always see is the intersection between your values, your public health training, and the policy / culture / sensitivity around certain issues. For example, when I was with the Malaysian AIDS Council, how do you talk to a group of Muslim men about harm reduction involving, you know, men who have sex with men, involving their relationship with sex workers and injecting drug users and then going back to their families. So I would say that's a challenge that every public health student will face if you go into public health, because everywhere you turn, you will find yourself having to, I would say, reskill, reinvent what you know, reinvent yourself, add to the skills that you have to sort of navigate the nuances, especially coming from Asia. It's not easy to navigate between these three things. And I think that would be my answer in terms of, yeah, your values, your public health training, what is right, what is working in other contexts, but the local context, policy, the local policy, the taboos and the sensitivities. So navigating that has always been a challenge, but also a chance to reinvent yourself and what you know and the skills that you have. The second, I would say, is to have a seat at a table. If you want to be in public health and you want to, like Tiara said, be a bolt in the whole ecosystem of making an impact in policy change, to have that seat at the table, you have to sort of establish yourself. Allies should know you. You are fresh out of university, you may feel that, oh, this work is for the collective good. It should be welcomed. But you'll be surprised. And I think that would be my the second thing that I would say is the challenge, is to actually have the seat at the table, for people to look at you, take you seriously. And who are you, right? Who are you? There's so many public health graduates, why should we listen to you? And to build that rapport, to find your niche and uniqueness has always been a challenge. And you may not always have a seat at the table, and you will face many rejections to even have the voice that you carry from the community heard, because as a vessel, you're no one, you don't have a PhD. So I would say those two. Thank you.
Thank you, Lola, because you don't have a PhD. Well, I'm going to ask somebody who has. See, that's your cue. What are the challenges that you face? And
yeah, I don't think a PhD does anything. It can be just a title. Yeah, no, this is an interesting discussion. I would say I would take it from both individual, like a personal challenges, but also in the environmental challenges in public health. For the individual challenges or personal as a public health researcher, and more of an academic, sometimes we feel our work is not impactful, or that the impact is too slow in generation, you know. So what you did, what you think was a great research, for example, for 6 months, a year, 2 years, does it really impact, you know, the policy? Does it really change people's life? And sometimes you don't see that, you know, in the years coming along, and sometimes it can be a bit of a disincentives. For me, sometimes I do look at, you know, whatever I publish or write or work on, does it really matter? You know, should I just go and move to Maldives and, you know, lay on the beach? Sometimes I do feel like but I also would like to always self-reflect, and I couldn't say this enough. I don't think too big of myself, as long as every day I make something positive, even though just a bit. And if it's contributing to, you know, whether I analyze a health financing that someone might use to advocate something, someone might use to increase budget for HIV/AIDS or maternal health in a district somewhere, then that's okay. You know, if I can give that evidence, then I'm useful. And also that's why I like teaching, because if you can generate some thinking into the students, you know, just give them a different perspective, like what we're doing now, hopefully, you know, just to make them think a bit more. Oh, maybe I can do this, maybe I can do that, maybe this framework is wrong, maybe it's not applicable to Indonesia, to Malaysia, or Thailand, or whatever setting. Then that it's a change that I want to be part of. But also then at the institutional level, or the environmental of the public health, it's the system itself. It has become too complicated for us to sometimes see what are we doing, right? For example, if you work as a researcher or an NGO, sometimes you just do what you do and you forget the big picture. You know, because there are so many actors, so many sectors playing in the fields, and then you forget, okay, what I want to do is to prevent this one woman not dying from delivery, you know, or from pregnancy, right? But sometimes we focus on, oh, my program has to be implemented, A, B, C, and D. We have to monitor, evaluate, give evidence to the donors so we get more money. You know, sometimes we forget that as well, just because the system is so complex. And then I just want to reiterate, you know, that as public health students, go back to what change do we want to see, like Lina said, right? What change do we want to be part of? What lives have been impacted by all of this issue, and how we really could change that, instead of being, you know, just day to day, 9 to 5, do what we do and forget the big picture. And also the third one is the complexity of the health system and the health policy. A lot of different, I would say, but first I have to say that public health is maybe one of the very few fields where everyone has good intentions. Maybe in banking, not everyone has good intentions, right? At least not for the public goods, you know. But in public health, everyone has good intentions in the public goods, you know. They want to promote public goods. But in reality, everyone has their own way of working, their own agendas. Sometimes it's conflicting, you know, even between the national, provincial, district, hospital, whatever. It's has different values. And maybe the values are the same, but different approaches to things, and that can complicate your work as well, either as an academic, a researcher, you know, NGO implementer, and all that. And again, it's easy to sway us to, you know, working in silos and not looking at the big picture. So I think I just feel that I need to remind myself why I'm doing this particular analysis, for example, right? If I'm looking at data, I'm doing my statistical analysis. What is it for? You know, what am I trying to produce or trying to influence or impact on? So those are the challenges, and sometimes it's up and downs, you know, throughout the day, throughout the week and year and stuff. Yeah, so maybe that's what I can add to this one. So thanks.
Thank you, Tiara. Lina, I know you've touched a little bit on the challenges before. Now, my specific question would be, what's your resilience factor? What made you still do the hard work, the hard and the hard work, right? So what is it?
You know, I just am reflecting of what on what Tiara said, that one woman, how do we prevent her from dying at childbirth, right? Holding up that purpose and not losing focus as we deal with all of the complexities of the health systems and everything else. That is the part of the fight and the battle, but not losing focus on that child, that woman, that we know we are living for, that purpose that is related to the person. I guess at Rachel House, just like what you said earlier, so if it's not us, who else would it be when, Tat was saying he never thought of leaving. That is the very thing that is often talked about at Rachel House. Our team continues to remind me. During the pandemic, I almost gave up because we were at one time down to 2 nurses and we had 45 patients on our load. And there were no other organization providing home care for the poor in Jakarta. We were the only ones. And so it was at that time I called for a meeting and I said, maybe it's time for us to retreat. And the team, one of the nurses who's been with me for 12 years said, how can you say that, Ibu? We've been here all the way. And if it's not us, who else is going to look after these children? And, for the first time, I felt like I have an incredible partner in the team. And I think that's the resilience, that having partners on our road to always remind us why we stay, because the journey is long, just like what Sierra was saying. Sometimes you feel like you're not impacting anyone, but actually that one person in front of you, that one person who took your research, that one person who called you and say, how can I battle this? How can I actually get people to change their mind? Because changing mindset is part of the health system and part of public health. And I think that is the resilience factor, that you put a face to your journey, you put a face to your purpose.
Thank you, Lina. That is beautifully said. Now that you've shared to us the resilience factor, now moving forward, what is the opportunity? And also considering that we're talking to most likely younger generation now. Now, what is the opportunity that you've seen in your field of work, in your role, and how do we move forward, and how can they help? How can we help? How is that gonna help your work? And anyone who wants to go first? Tiara, let's start with academics. Where's the opportunity? Where's the opportunity, and how can this young generation be inspired to do what you do?
What I do? Is it going to the Papua thing or the boring statistical stuff?
Or the Maldives stuff. Or the Maldives.
The Maldives stuff.
Where's the opportunity to help and contribute in your field of work?
What is the opportunity and?
The opportunity to impact a certain, maybe you have an idea where this is going to develop, and where this is going to be taken forward, and where the younger generation can actually come in and make an impact.
Right. I think picking up a health issue that you are concerned about is an important thing. I'm gonna talk from academic point of view, because you have to hold on some topic or issue that you think it's worth investing your time and mind on. So for me, that would be the maternal health and child health, even though I'm talking about health security now or One Health, but in my mind, I'm always going to be a health system researcher focusing on women and children's health. So that's one way to kind of have an anchor in a sense. So I'm going to invest my time to build up my skills, so I fully understand what's going on, so I can help in bridging the gaps in knowledge, because I'm an academic, in knowledge or whatever work that would help, a district or a province or, a hospital invest better, for example, in maternal health. That's where I would do. But also it takes a lot of time investment, I think. So the way forward for students or early career researcher is also to know what skills do you need so that you can contribute more positively, right? So you cannot be just halfway to whatever your goals are. You cannot just be like a so-so researcher or a so-so NGO worker. You cannot be any so-so whatever, because you're working for people, and in essence, even though you're not dealing with them directly per se, but just do 100%. You know, of course, it's not every day. I couldn't say to myself even like I'm doing 100% every day. Of course not. We're humans, but you know, whatever skills uptake you are trying to make for yourself, you're doing it because you're gonna make yourself a better worker for people, I think. And the other one is the way forward is to be humble and have some humility, because especially in public health, you cannot work alone. You know, you're not gonna be a superhero who's gonna solve everything in the health system or the health policy. That's why I'm very happy to be the nuts and bolts in a system that works, and be aware that you won't be, you know, you won't know everything. You will need people, you will need your peers, your students, your mentors. And I think we cannot have enough humility in public health, because once one person would want to be a superhero in public health, everything would just crumble. I think that, thanks off.
Thank you, Kiara. Paula, so what's the opportunity? What's the aspect of opportunity in your field of work? Where do you want the young generation to go next?
For me, I think from the perspective of international organizations and NGO, if you see yourself being part of an international organization or a local NGO or a local NGO in a country that's not yours, I think the opportunity is collaboration. Like, I really like what Kiara said, in public health, there's no superhero because you have to have a team. Like Lena said, like if you have a good team, you can really get your objectives going. I would say that the opportunity for the young students, and I always, when I say this, I feel really old, whatever. I feel that you will face a lot of rejections and you must be courageous in the rejections you face, because it's not just one, but you must also be humble in the success that you have, because it's a collective success. That being said, I think the opportunity, for example, for me was when I left UNHCR, which I thought was my dream job, because I really wanted to go to Lebanon and because I wanted to work with Syrian refugees in Lebanon. But there was no opportunity. I applied to 54 places, I remember, getting rejected 54 times, either silently or not, only to be able to get to Lebanon by a local NGO/ministry that sent me when I applied for a grant. So sometimes you look for opportunities all over the world, 54 organizations, but then it's right in front of your door. Like, I was lucky, of course, but it's also when you have the opportunity, take up on it. Like Kiara said, like, do not be 50-50, be 100%. And from that, the second opportunity I would say is contact your network. If you do a good job, it says something about you, and if you don't charge too much, they would also, those combination would bring your name. Like, oh, if you want, you can send her reporting on this. So those are the opportunities. Because of your work ethics, you build your connections, you build your contacts who will also recognize the skill that you have, the passion that drives you to complete something that you start. That is the second opportunity. So number one is opportunities that are right in front of you for collaborations. Second would be your work ethics, to prove your work ethics and to have more contacts, more team in your career. You will meet with so many people who would work with you, who would give recommendations, who would meet you again at the table. So I think those two are really unique to public health, because it's actually small. Yeah, you would end up meeting the same people.
The same people with good intentions. Okay, Chad, over to you. What do you think in your field of work would be the opportunity to contribute?
Yeah, I think particularly, we work with the private setup for like like 2 decades, and it was hard to convince like meaningful integration of private setup in the like Maze health system. And but now because of the COVID and because of this current political crisis, now is that the view has been changed, and then the rule of private sector has been more and more obvious. So that this I see that as an opportunity for like a establishment of like a Maze health system at the system level. And second is the emerging disease, like both like a communicable, notifiable disease and non-communicable diseases, and also in current rapidly changing context. For example, like previously we did not have enough attention like for mental health. Now we have not a lot of attention because of current situation. So I think those are like opportunity as well. And also, as we have so many challenges, every challenge that we are facing is a kind of like learning opportunity. How do we tackle those issues? How do we document that? How do we share those challenges to like in the similar situation with the if some country or some area is facing the same situation? I think that is kind of like a learning opportunity for us. And we also see like there is an opportunity to empower our people, like even our staff, our providers, because you cannot give like very micromanagement day-to-day decision by yourself. So you have to empower them a lot. You have to trust them a lot. You have to make them decide for their action points. So that's also good for like a growth opportunity as well. And also we have to be adaptive and resilient to those kind of like, I think our immune to resilient will be improved after these 2-3 years. So for the kind of like for the like our colleagues in like public health area, what I like to say is that to keep staying in this like it's require a lot of passion. I would say the passion drives you, because we have challenges. Some are like implementation, some are HR, people management. You don't even want to work in like hiring and firing people, but those are the challenges you have to do anyway. But you need passion, you need passion to keep working in that area. And also, as Tiara said, in the health policy, health system, something, it's like a lot of time, to make something happen. So we have to be very persistent on what you want to do, and then we have to be very engaged of what we want to do, that, we have to be on the table, and then we have to work with a lot of people. So that's why also that Paula said networking is very important. We have to work with different stakeholders. They might have different viewpoints, different agenda, so that we have to find common ground consensus working with them together. And also we have to be, I think, more, proactive, because we always said in public health, prevention is better than treatment, but it's hard. What do we prevent? What are the next things coming? That we have to be proactive in working in, like, thinking ahead of like, something bad is coming. And also, I think like, fundamentally, we public health workers, so that we are kind of like humanitarian workers, that our fundamental values, like, we work in the open society, we work in liberal, with free thinking, and also we are equitable, and we have belief in justice. So those are the fundamental things that to keep working as like a public health professional, I would say. Over to you, Sophie.
Thank you, Dad. Lena, what are the opportunities that you see in your field of work where the young people can contribute?
I just want to say that as Sad and everyone in Kala and Tiara was speaking, I keep remembering Viktor Frankl's words from The Meaning of Life, that if you have the why, you can go through anyhow. So if you have the purpose well entrenched in your being, you can go through anything. You can stay in Myanmar, even though there are like thousands of bombs going through and drone zones or drone attacks. You can continue to navigate through all of the health system like Tiara, even though, and because you know what you want to do. Anyway, the future. the future post-pandemic has changed. And I think much as we would like to think of the future remaining the same and we can go back to the normal, I don't think we'll ever go back to the normal that we used to know. And as the pandemic was going through, the world is also changing in what we look at today, where we are in a high inflationary environment. On the 27th or 28th of July, we're going to go through an overshot day where the world, for the first time, will see us spending our future generations' assets. And we're basically continuing to spend and consume more than what we can actually sustain. So in the world of public health, in the world of where we are looking at justice, equity, and food sustainability, we cannot be separated from all that is happening in the world. But one good thing that has happened through the pandemic is also the digitization. And we are looking at telehealth, we're looking at this webinar. I think in the old days, we used to fly to actually attend these conferences, but today we no longer have to. So we no longer have to burn all of this carbon just to make sure that we can share our opinions. So health and healthcare is probably one of the slowest area to evolve. And I think we have a lot to learn from the financial sectors where cryptocurrencies and everything else is coming through, not always stable. And we have a lot to learn from education and sharing of information, where today a lot more education is actually going online, an online platform. And what can we do in healthcare to make sure that, one, if we are honest to ourselves in health, we're probably the greatest perpetrator today of waste, and especially post-pandemic and during the pandemic, we're incredibly, we have a crime of basically plastics and everything plastics that we throw out. And what are we doing about that? Or are we just closing our eyes to that? Because at the end of the day, the poor is the most vulnerable to every waste that we actually create in this world. And we have children at Rachel House who come in with skin disease and skin cancer in the entire family because they live in an area where there is so much chemical waste. And these are forgotten stories. So I think the future comes from giving voices to every, like what Hala said in the beginning, the margins. Giving voices to what we see and using the platforms that we know and creating much, much larger education. And not only to the people who work in the social sector, but also to the governments, using people like, leveraging, not using people like Tiara in her job, and making sure that the government actually read the researches that, and policy changes are being made through that. So there is a lot of hope that I have, being an outsider from the, coming in from the financial sector and coming into the healthcare. When I see a congregation of people here, I have a lot of hope, because even though Tiara said that she leads a boring job, but the reality is the government actually listens to the academicians and very much less to the NGO world. So we need voices. We do need voices from all sectors. But the key, and I think we all actually reiterate that, is in collaboration. Because there is, I think, the African saying that if you want to go far, if you want to go fast, you go alone. But if you want to go far, you go together. And I think together we can achieve so much more. And but it takes humility in recognizing that everyone has a role to play. So that's me. Thanks, so.
Thank you, Lina. During the entire discussion, I think there are a few keywords that keep popping up, and definitely collaboration and humility is two of the most talked about topic or keywords during our session. I would also like to remind the audiences, if you have any questions, you can put the questions with the chat column or ask directly. You can raise your hand. You can activate the raise hand feature on the bottom of your screen, and please include your name. If you do put it in the chat, please include your name, institution, and to whom the question would you like to be addressed to. Thank you. So now we're at the end of our session. We have discussed what brings you to what you do, the challenges that you face, and the opportunity or the future that you're looking into the field, in your respective field of work. Now, if there's anything that you would say to the younger generation? I guess this would be like tips and tricks, but also maybe mistakes that you've done that you don't want others to do, or things that you wish you'd known when you went into public health, or things to avoid, not to go to Papua, for instance, or go to Papua, for instance. The little things that you encounter during your journey where you want people to do or not do, or the kind of like the guideposts. What would you say to the students listening? Hala. Hala.
That's a really good question. Sorry, I'm still processing what Lina says. I mean, whenever Lina says something, I really like, oh, wow. So, okay, back to your question. I think, I feel that us with the training in public health, I imagine that we have lenses, like a glass that you put on. And I would say, let your public health glasses be your guide in whatever work you find yourself into. Because for me, if you go with the flow and you sort of go from I change jobs, and then so you change different jobs and you're in different settings, you're in different communities or countries, but what remains is the glasses. Like everything you do, whatever work you find yourself in, you try and look at things from a public health lenses, even though your job is not, like for me right now, as a humanitarian affairs advisor, it's not traditionally public health, but the training that you have is so essential, that guides your work. And I just don't know how to explain it. I do feel grateful for having this education and this exposure in public health, because the glasses that I mentioned is something that I think has really been the guiding light and building block to the work that I have done and will continue to do. Yeah, so I would say that. As for mistakes, there's so many. There are so many mistakes I've done on the field and in the office, in the reports. I would say though that do not be afraid to apply for things that you are not qualified for. I feel that we always have imposter syndrome, especially as Asian women. I feel we always feel like, okay, maybe this one's not for me. Maybe this is, I've never really seen people like me in that position in this country or whatsoever. I think that you should just go for jobs that you're not qualified for. And the reason being is that I think we sometimes, it's really good to be humble, of course, but sometimes you don't give yourself credit enough to try. And I think for the fellow students, talking to the younger versions of us, the finalists, I would say go for it. My mistakes, I think, in my many mistakes, is to sort of, not go for certain things because you think you're not good enough. Yeah.
You, Hala. Next, Tiana, what would that be? What listening in?
So if you're breaking up, but I think I get the question. Maybe start with the mistake first, yeah. Like Haula, and I think like a lot of us, especially at this stage of the career, we have made quite a lot of mistakes. But I think, I don't know, maybe it's just me, but I think I can say yes to too many things and end up not delivering or doing things that you don't feel like it, but still not leaving the job. So for instance, I did a project which I didn't believe in. I should have just said no, or point out that no, this is not worth it, not worth the team's time, it's not worth my time. But sometimes we don't do that because sometimes you just say yes out of courtesy. And I think in the COVID era, we said yes to too many Zoom meetings and ending up not engaging well. So maybe what I'm trying to say is try to just say yes to few things, but then go 100% on that, so keep focus. It's easy to be distracted, especially as, early career public health professionals or researchers. We try to make ourselves visible, right? And we are so afraid that we might miss the train or we might miss the opportunities, but we might also, end up saying yes to too many things just because, like Paula said as well, imposter syndrome, trying to prove ourselves or doubting ourselves. So, yeah. And I think on a more positive point on that, we said about humility and being humble and collaborative and co-grow with your peers and whoever that might be, necessary in whatever your goals are. But also, I think we need to be someone who people like to work with. I couldn't stress this more. In the field of public health, like Hala said, it's a small world. So what I have reflected on is, as long as you are respectful, you do your job okay, right? Great, perfect, whatever, just okay, but you're collaborative and if people like to work with you, it will bring you to places. Like, trust me. And then don't think too much about what you're gonna get back from whatever you do, especially in terms of money. Of course, we need money, but we don't go chasing money, because when you start chasing money, just go further and further away. And in the world of public health, it's not gonna give you more funding or whatever. The thing that gonna brings you money is actually doing thank you projects, and in academic, we have a lot of thank you projects, meaning that people would commission you projects that is not well funded or has no funding at all, but you do that because it's important, because it's important for the district, it's important for the NGO that you're helping with monitoring, evaluating. They don't have money, you just do it. It will one, of course, it will grow your network, but people would know what you're capable of and that you're nice. Being nice is important, so people like you. But don't do it out of what am I getting back from this. But yeah, I think it's you can be a hotshot academic, but once people know you're not nice to work with, that's the end of your career, trust me. Maybe that.
Thank you, Kiara. Other than do not be a bad academic, Chat, what is your lesson learned, or what do you want to share to the students?
Yeah, I could win in that mistake competition. So we also do a lot of mistakes. Yeah. So I think we should do a lot of homework before we start the activities, like whether the activity has been done by someone else, or whether they are similar organization doing similar activities, or otherwise, because resources are very limited, so that we don't want to repeat reinventing the wheel. So that's doing our homework is an important point. So, and also I think because I think we work with the communities, and also it's always important to hear the voice of the community, that we work with the, health service provider, to hear the voice of, health service provider, because it's not always like a, a program side, making the decision. So that we have to be inclusive about, their inputs in designing the, project activities. So, and also continue receiving the community feedback about whether the services we delivering are really beneficial to them or not, and then also any like a room for improvement, so that we should have like this improvement mindset, because otherwise it's hard to keep going. And also I think because in the a bigger vision, like universal health coverage, so that we are a part of the that a bigger vision. So then we have to see what is the like our like a valuable contribution in that part, and also how do we align each other in within in the system, and also from the like a system thinking mindset, because although we are doing public health is not alone, because we have to understand about what like agriculture or like education, or what are other social determinants of health in this like a public health, and how do we facilitate in work in that associated determinant of health as well. Okay. Over to you, Sophie.
Thank you, Ted. Lena, what's the tips and tricks, I guess, lesson learned from you?
Big lesson, never make assumptions. Even though I was brought up with a tagline, when you assume, you make an ass out of you and me. I made a big, huge assumption when I first entered Rachel House. I assumed that if I built a 60-bed and to serve the poorest will come. I didn't do what that say, listen. I didn't do what that say, I should do research of the community. I assume that they will come. Today, we use that reminder always, because, so in healthcare, and all of you will know as a medical professionals, if you assume, you will always run, a danger for your patients, because if you do not actually do the proper investigations and you assume ahead of time, then you don't do your patient a favor. So assumption is one big factor that I know that, having learned the lesson, we'll never do. Mistakes, I hear a lot of the people talking about mistakes. That's another thing that we learned at Rachel House. Never, ever be afraid to own up to mistakes, because mistakes are learnings. And if we bury mistakes, then we miss out on learning what we need to learn. And for us, when a child dies badly under our care, we actually take time to learn what went wrong. And I learned when I came into healthcare that this is not something that is done very often, that people often walk away because they are too embarrassed with mistakes. And but at Rachel House, we make it a point to always talk about what went wrong, because we honored a child who has passed and didn't pass well and didn't die well, and know that that's a lesson that we need to hold in our hearts, that never again will another child need to go through that path. So I think for us, mistakes means a lot, because in healthcare especially, I feel there's so much suffering. And even particularly for the healthcare professional, it's like being at war. I often say, entering the healthcare, I just realized being an investment banker was a breeze, because healthcare, you're worse than soldiers at war, because you don't even have a break. You're not even given time off to return home for that, time to rest. So I think in public health and healthcare, the amount of suffering that we all see, I think it behooves all of us to hold on to a guiltless trip, and not hold mistakes as guilt, but take mistakes as a path to learn from.
Thank you, Lena. Good point on mistake. I see a raised hand from Dia Ayu Suspenderi. Ibu Dia, do you have any questions for the panelists? And please do address it.
Thank you. These sessions give warming my heart, and it's like food for the soul. So I would like to ask more, allow me to ask more personal. So to all of you, so during your lifetime, so who is the strongest motivator that helps you get along with all challenges? And the second one is, could you give me or share your thought on how to balancing career path and family time. Thank you.
Thank you, Budia. So 2 questions to the panelists. One is, who is a figure that I summarize can be a mentor for you during the journey and has been a mentor for you during this journey? And how do you balance quality time with family or yourself versus versus time at work? Who wants to go first?
I can go.
Okay. Yes, please.
Maybe not on the family time, yeah, because I don't have a conservative family setup here. So I'm just gonna focus on the first one, Budia. I don't think there's one particular role model in my career life or personal life that I learned from. Of course, we have mentors, people we look up to, I think, but also in terms of challenges, maybe that would be my mom. So she graduated just a diploma when she was young, because typically family with 9 kids, they couldn't send her to higher university grades, so she had to took up a job as a secretary at one of the Indonesia oil company. But then she decided when she was 45, I think, to go back to uni and then actually go for a undergraduate degree. So she got that, and then as a background, what she really wants to do in life is to be a lecturer. So she wasn't happy working as a secretary. It was a ends to means, right? Or means to an end. But then, yeah, she got her undergrad at 45 or 49, I forgot. And then when she retired at 56, she visited my brother, who is currently studying in the States at the time. And then she said, oh, I'm going to enroll myself in a master program for a year. And then she did that at 56. And then it was against all odds, I thought, and and if my mom, who is 70 now and still teaching and able to learn how to use WhatsApp, I think any challenges that we have are peanut, so maybe that's the role model, one of the role models.
Thank you, Tiara. Next. Who wants to go next?
I'll go.
Okay, Lina.
Thank you, Budia. I think, when you say food for the soul, we need it, right? The person who, I guess, today in my adult life, I keep most at my heart is Dalai Lama's words, be kind. I think in a world where there is so much tragedy, kindness is such an incredible language that we all share. So kindness, and that's one thing that I hold. And every day I'm inspired by my team at Rachel House. So they're my teachers and our patients. Humble as humble can be. I think in Indonesia, we often talk about how, around the world, we often talk about how, the poor may take advantage, they may, not be grateful. But I see teachers in our lives every day, the kindness and the generosity of our patients and their families continue to move my heart even after 15 years. So I think that's the one thing that I hold dear to me. And family, and even though like Tiara, I don't have family to talk about, but at Rachel House, we do have a lot of staff with family. For us, and I think this is where I hope in future healthcare and health sector will continue to change, is that family must come first. We cannot hope to have healthcare professionals care for our patients if hospitals and hospital management continue to treat healthcare professionals as second-grade citizens and demand that they come into hospitals to care for patients when their family members are sick. So at Rachel House, we have one rule. If your family is sick, you stay home. because I cannot expect you to come in and care for our patients if we don't care for you and your family. So I think the world has to change in the way we care first for our own family before we can be expected to go out and care for others. That's my
Thank
sort of
you.
time to do advertisement.
Thank you. Who wants to go next, Chad or Paula?
I can go.
Okay, Chad.
Paula, you go.
I really like that question, Budia. I think motivator, I wish I could say an easy answer to this, but I think motivators have always been, for example, the fisherman who joked about, you know, the amount of fish he caught while not sleeping for 24 hours. It's the group of refugee women, if you ever find yourself into, you feel they can do anything. The refugee women who told me when we didn't get our grants approved, hands to work, hearts to God. Don't think about, you know, not getting the money, it will come. It's the refugee chef from Syria who lost everything, came to Malaysia, tried many times to open his business. It's the woman in detention who asked about healthcare for the children. I feel like these are the motivators that I really wish for the future students you will meet. And if you recognize that, they will motivate your next step always. Balance between career and work. I think I recently got a baby. I mean, he's 17 months and he's crawling and walking and eating grass. So I feel that, Ibudia, I don't know the answer to that. However, I do know that your action dictates your priority. And so if your priority is your family and your baby, you have to act that way. You have to drop certain things. You have to say, like Tiara, like say no to certain things. And I want to say about Lena, we are all responsible post-pandemic, especially, to create a work setting that allows for family life to thrive as well. Because I think, you know, sometimes you have to bring your baby. If I have to travel somewhere, I will bring my baby. We need to have that system where everyone cares and you are allowed to, you know, have a multifaceted life, because you're not just one faceted. And so I think, yeah, I would say in terms of balance, I don't know, but I will always want to act according to my priority. So yeah, right now it's my baby, of course.
Yes, and having a system that supports that really helps. That is true. Chad.
Yeah, I have a supervisor like 10 years ago, and we were like colleagues. We were like friends. Then he was very good in active listening, and then I could share with him like you know, any story, any feeling, anything, and then he listened. And you know, talking with him was kind of like, you know, a reflection time, you know. So it was very like you know, very valuable for me, you know, for my thinking, for my growth, and you know, the way you know, who I am today. And I have a lot of support. And I didn't know that he was suffering from like you know, a cancer during that time. And I only knew that, you know, I left the organization and I moved to like a grad school, and only that time I knew about that. I was surprised, you know, why he was suffering from, you know, this thing. And then he was still able to pay attention to me. Not only to me, he paid attention to many other people. So I kind of like, unfortunately, he passed away in 2016. But he was still kind of like, you know, one of my like, you know, most memorable mentor in my life. I still hear a lot of his voice, his talk, you know, advice to me. And the second motivators are like, you know, we work with a lot of like, you know, general practitioners in the country. You know, some of them, we worked with them since 2000, 2001, like, you know, over 20 years. They are passionate. Whenever I talk with them, you know, I got the energy from them, you know, to keep going. So that, you know, even although they are working in very small clinic, that the energy, the flowing with them, the way they are passion to serve their community always motivate me. And the family part, I have 3 kids. The eldest one, 15 years of one. The middle one is 10 years, and the youngest one is 7 years. And whenever I have time, they are very important part of my life. And I spend time with them, as much as I can. So that's how family is very important part of their life story as well. Over to you.
Thank you, Tad. I'm so sorry about your mentor. It's a good thing that you've been a part of, he's been a part of your life as well. Okay, so we do not have any more questions for the audience, but I do want to read out a comment from Ibu Sandra Fan. I have no questions as I was immersed with the insightful conversation. Just want to thank the inspiring speakers for the wonderful reflections on your work. We can sense your passion through your stories. And thank you for the committee to arrange the session. I just realized that a personal conversation like this among public health professionals was quite rare in my knowledge. So as Budia said, this was like food for the soul, especially for us, the early career public health practitioners. Best of luck for all of you. I could not agree more. Thank you so much for our wonderful panelists. Before we close the session, I know Lena has to leave in 3 minutes. So before we close the session, let's have a picture to remind us of the wonderful session that we had today. And I think the committee will be in charge of the picture. Judy?
So turn on the camera, put on the best smiles.
Camera on, anyone who's willing to take a part in the picture with your face on. Don't forget to smile. The committee will be ready to take a picture. Okay, since Gabby is not responding, I'll read out. So that everybody's ready. I'll read out 1 to 3. Right, Gabby? Please help in taking the screenshot.
Yes, I will take.
Okay.
Okay. Please open your camera, and we start from the first screen. 1, 2, and 3. Okay, and hold up. And the second screen. 1, 2, 3. Yes, thank you.
Okay, thank you so much, Gabby. Thank you so much, everyone that has participated in the session. We do hope that the insightful conversations and the experiences of these amazing panelists can inspire you to do what you do best in your work and explore the opportunities before you. And thank you so much, Tiara, Paula, Tad, and Lena. I am so inspired to hear your stories. I know you personally, but still there are moments during our session where I was like, oh my God, I can't believe I'm friends with these people. Looking forward to see you in person, hopefully soon. Thank you so much, and have a good afternoon, everyone.
Thank you so much. Bye-bye.
Bye.
Bye, Hala.
Thank you. Bye.
Lena. Thanks, Sof.
Thank you.
Okay, so thank you to our wonderful panelists and moderator. On behalf of the committee, I'd like to share our sincerest gratitude for the panelists and moderator. And for the participants, I hope you will leave the conclusion for you. So yeah, it was very inspiring and truly wonderful. Yeah, so we are now still in the first day, and we hope that in the second day and the conference itself on a Friday and Saturday will bring us to a lot of discussion about public health and health systems. So Good afternoon, everyone. Assalamualaikum warahmatullahi wabarakatuh.